Thank you, Christina. I want to welcome everybody today to the webinar, introducing you to a new resource to aid individuals, including you, that are interested in evaluating community-level obesity prevention efforts. We are delighted to have you join us today. Thank you. So next slide, please. I'm Leslie Stidham, Senior Program Officer at the Institute of Medicine's Food and Nutrition Board, which is a programmatic division of the newly branded National Academies of Sciences, Engineering, and Medicine. So today, the new resources we're going to talk about is a compilation of resources found in the 2013 report, Evaluating Progress in Obesity Prevention Efforts, a Plan for Measuring Progress. We will begin today first with an overview of that report by the chair of the authoring committee, Dr. Lawrence Green from the University of California, San Francisco. Next slide, please. Thank you. We will then hear from another committee member of this report, Dr. Stephen Fawcett, who comes to us from the Working Group for Community Health and Development at the University of Kansas. Dr. Fawcett will walk through the recommended steps in developing a community-level obesity prevention evaluation plan. And then finally, we will hear from Ms. Christina Holt from the Community Toolbox and Work Group for Community Health and Development at the University of Kansas. Ms. Holt will close with a look at the new resource page, which includes information that's available to help guide and support each step of the recommended community-level obesity prevention evaluation plan. And then finally, we will end the webinar with questions and discussion with the participants. Thank you. So before I turn to Dr. Green to start, I have three logistical notes. When Christina has mentioned this a few times, we have muted the audio for participants until the question and answer period. But if you have questions as we make our way through the different presentations, please do submit them as you think of them, so you don't forget them, through an email at what you see there is at toolbox@ku.edu. And if you have other issues connecting or hearing us, there's a 1-866 number that you could call. And then finally, Christina already mentioned this, but this webinar is being recorded and will be posted on this new resource page that we'll be talking about as an introduction for future users. So with that, now I have the pleasure to turn this over to Dr. Lawrence Green. Dr. Green?
Thank you, Leslie, and thank you for all your work in putting this report together with us. Good morning to all of the assembled. Thanks for joining us for this event. It's a pleasure to introduce you to our report and to discuss its integration with other resources and guidance on evaluation in the Community Toolbox. Let me start on behalf of Leslie Sand and the Institute of Medicine and the IOM Committee by expressing our thanks to the sponsor, the Michael and Susan Dell Foundation, to all of the committee members, and to the Institute of Medicine and the Food and Nutrition Board staff, led by Leslie Sim, who worked on this report under the direction of Leslie. Next slide shows the names and institutional identities of the committee members. I'll leave this up for a moment as I point out the particular expertise of most of these people in evaluation and or in nutrition and obesity issues. Brian Flay was of particular help in shaping the evaluation issues across chapters. Steve Fawcett, who you'll hear from soon, with his extensive experience in evaluation and in technical assistance for evaluation, will also give you a deeper look at some of the issues that the report, in combination with other materials from the toolbox, will bring to us. The next slide. Well, the urgent need for evaluation is probably sufficiently familiar to you, or you wouldn't be here, but let me just point out particularly that the obesity epidemic in the United States and in many other countries has now presented us with serious health, economic, and social consequences for individuals and for society at large. The recognition of consequences has accelerated efforts to characterize and to understand the problems more fully, to take evidence-based and innovative actions, to evaluate the innovations, and to assure overall progress in obesity prevention at national, state, and community levels. Particularly notable in our committee's overview of the progress and evaluation were our observations of three things. One, that most of the standardized data available for surveillance and comparative analysis of progress was available only at the national and state levels. Very little of it available at the local and community level. Other than BMI measures in schools and medical care settings, there were few consistent, agreed-upon indicators of progress for local program implementation and effects. And this need for agreement on the measures that would be used across jurisdictions and over time has been a hallmark of the successful chronic disease control programs in our country. Many, if not most, localities had limited sources, we found, for monitoring and evaluation of their programs, including data and skills needed to collect and analyze data systematically. The next slide. There's a pressing need to act on the problems of obesity, for sure, but there are gaps in the certainty of the effectiveness of the actions that we need to take and the mixture of actions being implemented across the country and trends in obesity in communities. Systematic and comprehensive evaluations along with more routine assessments, monitoring, and surveillance often provide valuable guidance for improving the quality and outcomes of impact of the actions being implemented and for defining the direction of further basic and implementation research. These evaluations will be more useful locally and nationally if they're based on broad agreement on the use of indicators, measures, and methods. First, in assessing the status of the communities. Secondly, in surveillance to track changes in the status of communities, regions, and the nation. Thirdly, in monitoring the policies, programs, and other interventions associated with changes, monitoring how well they're implemented, that is. And summatively evaluating the extent to which the interventions and combinations of interventions result in improved outcomes. When we refer to interventions, we're referring both to policy and program interventions. Next slide. In this light, the Michael and Susan Dell Foundation asked us to develop a concise and actionable plan for measuring progress in obesity prevention efforts for the nation, and to recommend acceptable guidelines for community assessment and evaluation. These were to be drawn from the recommended goals, strategies, and indicators found in a previous report in 2012, the IOM report Accelerating Progress in Obesity Prevention, Solving the Weight of the Nation, which we refer to as the APOP, Accelerating Progress in Obesity Prevention report. Ours became known as the EPOP report, Evaluating Progress in Obesity Prevention. Next, you got it? Thank you. The concise, actionable plan that we were tasked to produce turned out not to be so concise, something like 250 pages. But it boils down to three major messages. One is enhanced leadership. The international comparisons point to the need for more robust leadership and coordination to promote accountability and communication. There are some other nations who really have taken further steps than we have in coordinated national leadership. Secondly, enhanced roadmap. We need an efficient roadmap for evaluators, decision makers, recognizing capacity and infrastructure. The need for enhanced capacity and infrastructure to facilitate evaluation efforts, including data collection and production, capacity to analyze and disseminate data to users to address measurement gaps. And examples of the gaps that we are most concerned with are lack of data on environments and policies, inadequacies in existing indicators, and inconsistent availability of the data at the local level. Now, in describing the National Obesity Evaluation Plan, we took great pains to pay attention particularly to the ways in which the national plans can be supportive of local plans. They need to be designed to organize the planning, implementation, and evaluation of obesity prevention and related policies and programs recommended in the APOP report at the national level, so that they can be implemented down to the local level. The National Obesity Evaluation Plan found in the APOP report offers key components for improving existing national evaluation infrastructure, resources, coordination, and efforts for continuous nationwide monitoring, surveillance, and evaluation. The plan that we have tried to lay out integrates and recommends enhancements of existing national surveys, evaluation studies, monitoring and surveillance systems that currently focus primarily on individual level measures. It augments these with recommendations for new infrastructure, indicators, and data that would add measures of environmental and policy changes recommended in the APOP report. So here are our 4 recommendations. Improved leadership and coordination. I've already said a few words about that, but what we really need is better communication across branches of government, departments, and the partners of the federal government that have particular roles to play and niches in the environment of obesity control. It was clear from a review of existing evaluation efforts at the national and community level that the evaluation plans recommended by the APOP committee will not be fully realized without organizational change and support across multiple federal, state, and local government agencies and departments in collaboration with non-federal partners. Given the existing gaps in current evaluation efforts identified by the committee, 7 key recommendations to support the APOP recommendations and successful implementation of the components of the evaluation plans were developed. The next, providing common guidance was a particular issue that needed to be harmonized across the agencies that are trying to provide guidance to localities, communities, and improving the acceleration access to dissemination of information about evaluation. Next slide. Improving a workforce capacity, that is the ability of communities to provide expertise and skills and collaboration, perhaps with universities in their region, to conduct evaluation. Addressing the disparities and health equity issues. So many of the measures need to be adapted to different cultures in our society. And finally, supporting a systems approach. That is, how do we deal with the complexities that go beyond individual communities and measurements as to their relationships and interrelationship among slide. The full report and dissemination materials are now posted on the Institute of Medicine website, iom.edu/evaluating progress. And that will take you to the reports and the dissemination materials. These include the full report with a short summary. In other words, you can read the full report online at the National Academy of Sciences website. There's also a 4-page report brief that you can print out, an 8-page pull-out of the indicators that, that measure the progress of obesity prevention efforts recommended in the APOP report, found in a variety of existing data sources, and an interactive web-based version of these indicators. Refer to that as a widget. Thank you. The committee identified indicators that currently exist, but on our evaluation and ongoing data sources, the committee identified appropriate indicators that were best aligned with the recommendations included in the APOP report. The 83 indicators identified provide a menu of possible indicators for use by evaluators down to the local level. These indicators offer a starting point for the development of core indicators and related measures. Next. We have a series of color-coded tables that indicate which of the more than 200 indicators that we identified, boiled down to slightly smaller, which are available for measurement at the national level, which ones are available at the state level, and which ones at the local level. And they're identified as to who proposed the indicators, which agencies or information. The next slide. A little more detail on that. I think I'll turn it over back to Dr. Fawcett.
Thank you, Larry. What we'll look at here is the piece that I'll talk about very briefly is some steps in evaluating community-level obesity prevention efforts. Recall Larry's point that the study charge was an actionable plan. We took that to mean the requirement that we break down for community-level evaluation, that we break down the steps into discrete actions that could help demystify the work of community evaluation. This is critical because we did not see the work as belonging to evaluation elites. The prevalence of efforts to address obesity at the community level is such that it requires engagement, we think, from a broad and distributed workforce and not a small set of prospective partners. Next. The vision for the report when we developed our own logic model for the report is this one. And I want to just draw attention to a couple of words. Meaningful data is the piece that I'd like to have us attend to. And the notion of meaningful is that stakeholders have gotten together and figured out what was important to them, that they've grounded the evaluation in their context and their situation, and they've identified implicitly a pathway from how we're going to get from here to there. And the premise here is that if the data could be meaningful, that people will be more likely to, the stakeholders are more likely to use the information for both understanding and improvement. The context for evaluation of community efforts to prevent obesity is such that these are messy affairs. We're not talking about testing the effects of a single program on a few children. Rather, we're talking about the typical context for community evaluation, multi-component, more than one strategy, element is in place, usually information, modifying access and barriers, perhaps changing policies. That it's multi-sector, that is not just school-based, but involves other sectors that can have influence. Um, and these would include, of course, governmental sectors, community organizations, and the like. And typically, these are multi-level interventions. They're operating at the level of individuals, organizations, whole communities, and maybe broader systems. Add to that part of the context, as Larry indicated, that the indicators may be of varying quality, utility, and availability. And further, that there's varying capacity and capabilities for engaging in this work. So this was the context that we saw the report sitting in. So therefore, as we thought through how to be useful, we considered what activities were needed in the report by the committee to produce a report that would have utility. At the World Health Organization, for example, there's common reference to the valued contributions of common or normative guidance, that is, what's agreed upon guidance for how to do work, and capacity building. And so those are the first two bullets in what we'll talk about here, and really it's the rationale for why this particular toolkit. That is, we focused on a template for what the work looks like, community evaluation work looks like at a community level, and some web-based supports for it. The goal here was, as we talked about, this can't be the work of rarefied university research centers. The work of addressing obesity is so widespread that we need to figure out how to make this work accessible to communities and to resources close to them. For example, faculty and students in local community colleges. So we unpacked, and this will look familiar to those of most of us on the call. This is a task analysis of steps in developing a community evaluation plan. Those familiar with the CDC framework for program evaluation that Tom Chappell and Bobby Milstein developed so many years ago will recognize this. It also maps on to a toolkit in the community toolbox you'll hear from Christine in a little bit. We're going to take a look at these one by one, so I won't spell them out here, but it starts with designing stakeholder involvement and assuring that, and going through focusing on the measures, the plan for credible methods, and making use of the data for understanding and improvement. With respect to the first task of designing stakeholder involvement, I'll pause on this to illustrate what we tried to do in the report and what you'll see in the toolkit that follows. For each task, we identified the key activities. So think of this as overall going from a broad construct, broad process of community evaluation to unpacking this as a task analysis, these broad classes of activities, one of which is designing stakeholder involvement, and then unpacking the discrete activities that were associated with each task. The goal here is to make this explicit, to demystify, as we talked about, the process. But it also makes clear that nobody's trained in all of these tasks. No one of us. We might have particular expertise in evaluation design, for example, or data analysis. But we may not be as well skilled and well prepared for identifying stakeholders and engaging them and identifying particular needs and interests related to the evaluation. And it presumes that. It presumes that no one of us is fully prepared to do all these tasks, so hence the need for just-in-time supports, links to targeted and explicit resources that Christina will speak to. This also followed a participatory evaluation approach, a short form for what some refer to as community-based participatory research. Note that it starts with naming and framing the problem and goal, and a given community might frame the issue as being primarily one of health equity related to rates, prevalence of obesity in the community, and seeking to have its work focus on disproportionate, on the differential exposures and vulnerabilities that might be present for some particular populations that are adversely affected. And And as a result, and so the related steps, and I'll only just note them briefly here, developing a logic model maps on to step 3 in this set of tasks, identifying research questions to step 4, documenting the intervention and its effects, step 5, sense making related to step 6. The notion here is that these are shared roles and responsibilities for community stakeholders as well as evaluation partners. Next, please. I won't elaborate on this one, but clearly one of the tasks is to identify resources for monitoring and evaluation. Next, please. And as Larry pointed out, there are some web-based resources, and there's a nice table in the report that Larry drew upon that identifies some web-based data sources. And we particularly call these out, so work in the Community Commons, chna.org, especially the County Health Rankings, which has been a substantial investment that many of us are familiar with, and other sources. What the report did was identify some particular sources of data that may be useful. And this question of what indicators are available at the local level addresses practicality of evaluation, right? And here we're looking, we offered some guidance in the report on discriminating or differentiating between the kind of data that may be available for all or at least many communities, such as data on overweight and obesity that might be available from sources such as local BRFSS or YRBS, such as provided by the CDC at state level, and sometimes oversampled by counties. And then those that are available for larger communities, such as youth obesity and overweight and the like. The point here was to find one broad level of differentiation of what might be available practically at the local level. And next, more specifically, when we get to data availability, here we're looking for differentiating those that might be available with the color coding of green, more likely to be available, red, less likely to be so, green perhaps, for particular indicators. Remember, the task of identifying indicators that balance reliability and validity is to consider what's important to the work, what's accurate, what's likely to be sensitive to what it is that we're actually doing in a local community, and what's likely to be feasible. This red, green, yellow light system particularly highlights feasibility. The work of discerning what's sensitive and what's important to the local community is to be done with community evaluators in concert with community stakeholders. Another task is to facilitate the process of identifying the logic or the pathway from here to there. Those familiar with developing or facilitating the work of designing logic models appreciate that it goes from purpose all the way to intended outcomes and the steps in between. Next. We provided in the report an exemplar of a generic model for community evaluation that would likely need to be tweaked for work at the local community level. What we want to highlight here is it goes from the current, where we are now, initial conditions, to the pathway from inputs to activities to intermediate outcomes such as policy, environment, and systems changes and program expansion and so on, to changes in behavior and ultimately outcome, moving from left to right. Each arrow is a prospective evaluation question, denotes a place where there could be a potential evaluation question. More about that in a minute. But for example, we might ask questions about, did the intervention or the process of community engagement yield changes in programs and policies, environmental and systems changes? That's a question. Were these associated with improvements in behavior? Were those in turn associated at the population level with improvements in population level obesity prevalence? So a model like this can help us call attention to the steps along the way, the pathway, so that we can look at implementation, but also set the occasion for evaluation questions. Next, please. So this is essentially what we're doing in the evaluation when we're focusing the monitoring and evaluation plan. I want to call on one, so think of this as a utilization-focused evaluation, right? And the second bullet highlights that. That is setting priorities by end user questions. And there's a premise here that stakeholders are more likely to use knowledge for questions that matter to them. And so this process of facilitating who are the stakeholders, what are their interests, and this would include not only funders, of course, but community members and boards of action committees, and discerning what their questions are so that it could be so directed. Next, please. So once we look at the logic model and have that in play, we can then be posing evaluation questions that also reflect local interests. So an example of this is the middle bullet. Did the intervention have desired effects? Well, in a local context, this might include questions such as, was the community effort associated or did it produce changes in programs, policies, and environmental changes related to obesity? This would then, of course, set in motion the kind of indicators and methods and measures that need to be constructed to address the questions of interest. Next, please. So the plan for credible methods includes in particular stakeholder agreement on what represents questions, indicators, and methods, and indicators of success. Next, please. As Larry noted, one gap we saw was, and one need was, and we highlighted therefore, some emerging methods for data collection related to how the environment was changing. There's not a funder on the planet, I don't think, that's not focused on environmental and policy changes, what some call community programs, policies, et cetera. And therefore we provided some appendices in the report that focused on how one gathers such changes. Next. There are, in addition, some indicators of success that need to be identified. The point made earlier is these should map onto program inputs, intermediate outcomes, behavioral and population level outcomes, and these are some illustrative markers that would map onto the generic logic model. Next. I won't go into a lot about evaluation design, except to say the report, more than any that I've read, focused on a kind of the value of logic modeling as a way to cope with the nature and complexity of community level evaluation. We made the case that community level evaluation can show associations between changes in the environment and improvements in behavior and outcomes. There are, of course, other plausible explanations besides the particular things that were done when stronger designs are not put into play. However, if we've got a logic model in play and we're measuring implementation related to that logic model, we can strengthen the possibility for inferences because we can show associations between the implementation of the comprehensive intervention and the associated continuum of outcomes. This is further strengthened, of course, with replication, if we can show replication of effects across communities. Next, getting near the end here, a highlight here is around shared sense making, and the point we'll highlight here. Next. With a logic model design and shared sense making, we can look for the association between the unfolding of the comprehensive intervention. Let's say those community programs, policies, environmental changes, that's the blue line, and whether this bends the curve, in this case, prevalence of obesity. If we see such associations, and we see them repeatedly across multiple communities, we're in a position for the local community and investigators across communities to begin to make sense of what are we seeing, what does it mean, what are the implications for adjustment. The last slide then, and to set up Christina's closing piece, is hence, as we saw it, the need for an obesity evaluation toolkit that is brief, that is concise, that does recognize that whose work is this? As we said earlier, this is the work of all of us. Those working in local communities, evaluation scientific partners working with them, and this can't be left to a set of elites. We need to be able to have just-in-time resources that enable for picking this work up and doing it whenever we're ready. So hence the perhaps value of a toolkit such as this. Christina?
Hello. I am excited to join you today to share about some free online resources for supporting training and technical assistance to assist you as you seek to implement and support obesity evaluations at the community level. I join you from the University of Kansas as Director of the Community Toolbox, a free online resource containing 7,000 pages of free information supporting community health and development initiatives. We have been partnering with the IOM to make the Obesity Evaluation Toolkit with practical supports available online at the URL you see here. Or, if you visit the EPOP report page, which is also where the interactive indicators table can be accessed, you can access the toolkit there. On the screen, you will see the Obesity Evaluation Toolkit is the first link under Report at a Glance. So what does the toolkit contain? Let's dive in. A table of contents helps you navigate to the particular area for which you seek resources. For example, there are a number of general evaluation resources, and additionally, there are resources specific to the particular steps that you just heard about from Steve, such as designing stakeholder involvement, identifying resources for monitoring, and summative evaluation and planning credible methods. Under General Evaluation Resources, you will find links to curated resources available from the Institute of Medicine, Centers for Disease Control and Prevention, and the Community Toolbox. For example, the following IOM resources are available and provide support for encouraging decision makers and researchers to look at obesity from a systems perspective, recommendations for improving measurement of progress in obesity prevention, and recommendations for supporting obesity prevention through promoting physical activity and healthy food choices and evaluating obesity prevention efforts. Additional resources include a self-study guide from the CDC on program evaluation for public health programs and a number of community toolbox resources with practical step-by-step guidance on evaluation. For example, this is a look at the toolkit the Community Toolbox offers on evaluating initiatives. The toolkit is essentially a task analysis, walking through core tasks involved in evaluating community-based initiatives, with links to additional supports that can be accessed where additional guidance is desired. This is a peek into how a section of the Community Toolbox is structured by a main section, checklists supporting key points, related tools, and a downloadable PowerPoint that you are free to adapt and use in local capacity building training on the topic. In this case, the section features a framework for evaluating community health and development programs. The Community Toolbox resources available from the Obesity Evaluation Toolkit also includes a link to a troubleshooting guide with common barriers encountered in a situational analysis. This example resource troubleshoots the barrier we don't know how to evaluate our program or initiative. Reflection questions to consider are followed by links to related supports. This feature is helpful for both receiving and providing consultative guidance. We will walk through the steps in community evaluation and the related resources made available. So for example, this first step on designing stakeholder involvement, you will see a number of resources from the IOM, the American Evaluation Association, and the Community Toolbox. Practical guidance on things like how to identify who the stakeholders are and what their interests might be, and how to gather information to monitor your progress and report that to stakeholders. For step 2, on identifying resources for monitoring and summative evaluation, you will see resources on guiding principles for evaluation from the IOM and resources from the Community Toolbox, such as how to choose evaluators and on identifying community assets and resources. For step 3, describing the interventions framework, logic model, or theory of change, you will see practical guidance from the IOM and the toolbox, which helps to demystify the process of creating a logic model. And for step 4, on focusing on monitoring and summative evaluation plan, you will see a number of resources, things like how to choose questions and plan the evaluation, ethical issues in the community intervention, and how to document health promotion initiatives. For step 5, planning for credible methods, you will see a number of resources on different methods you might wish to employ in your evaluation and which tools may be helpful. A multi-method approach may contain not only accessing available measures, but also methods such as direct observation, surveys, and qualitative methods such as key informant interviews or photo voice. The available resources can help you plan for evaluation design and how to develop an overall plan for implementation. For step 6, synthesizing and generalizing, you will see a number of resources on how to best utilize information to inform decisions and improve the initiative, how to communicate information to funders for support and accountability, and how to refine the intervention based on the evaluation results. Lastly, there are resources available supporting the importance of taking a systems perspective and other frameworks and evaluation resources that can help support your efforts. We welcome feedback on the utility of these resources and suggestions for additions to these resources you have seen today. Feel free to contact us at toolbox@ku.edu, and we will be sure to pass along your feedback to the appropriate person. It is our great hope that these resources will help support your important efforts to implement robust and informative evaluations on comprehensive community-based initiatives to prevent obesity. I wanted to end to let you know that today's webinar recording will be available online. Leslie Sim will now lead us in dialogue, and we will attempt to address any questions that have been submitted to toolbox@ku.edu. If you have not had a chance to do so already and would like to submit a question, we welcome you to do so. Thank you.
Thank you, Christina. This is Leslie Sim again. I believe the lines will be open again for the discussion period. So if you have questions, please chime in and ask questions. Dr. Green, Dr.
All participants are unmuted. To mute your participant, press 7-7.
Wonderful. I think you are now unmuted. So if anyone has any questions for Dr. Green, Dr. Fawcett, or Ms. Holt, or myself, we would definitely open up to this time for discussion. And we have about 15 minutes now to do this.
Excellent. Thank you.
And if you are not asking a question at the moment, if you could mute yourself, that will help to minimize the noise on the line.
If I may, if there aren't any questions right away, I would like to start by asking my own question. What makes obesity control any different than any other health program or policy we need to evaluate at the community level?
Leslie, is it okay if I go ahead and put all lines back on mute?
Absolutely, absolutely.
Okay, I will do that at this time. If you have a question, please email it to toolbox@ku.edu. Thank you.
All conference participants are now muted. To unmute your participant, press 9-9.
Yeah, so I think we're going to get started again because there was a lot of feedback. So again, this is Leslie Sim, and we're open for discussion. And if you have questions, please submit it through the email address toolbox@ku.edu. And again, I would like to start asking a question of my own. It might have not been heard, so I'll repeat it. What makes obesity control any different than any other health program or policies we need to evaluate at the community level? I don't know if Steve or Dr. Green, Dr. Fawcett would like to respond to a question like that.
Yeah, let me lead on that question because it really had a lot to do with my decision to accept the responsibility of chairing the committee. It seemed to me that we had a lot of experience in tobacco control, for example, in successfully evaluating programs. But with obesity control, you have so many more disciplines involved, so many more determinants of the behavior, so many more types of programs and interventions and policies that might apply to affecting the outcomes of obesity. And for all of those multiplicities, we end up with the need for a different kind of strategy for assisting communities and the nation as a whole and states in evaluations that could be compared over time and compared across jurisdictions. So it's really the complexity of the obesity problem that presents us with, and the complexity of the participants in trying to solve it that presents us with the need for a special focused approach to evaluating it.
This is Steve. I think that was reason enough for this report to ground it in the context of obesity and prevention. I think the complementary point of view, though, is to also note the generality of this approach. Particularly the community evaluation plan, what Larry just described, those conditions of complexity especially, would also apply to violence prevention or substance abuse prevention, or community mobilization to bend the curve in Ebola virus disease in Liberia. It's the nature of this work. So I think there's generality in the overall process, and then specificity as it gets applied in the context of obesity prevention and the risk factors and setting features that are important.
Okay, and this is Christina Holt. We are receiving some questions now at the toolbox@ku.edu email. The first question was submitted by Deborah Kibbe at Georgia State University. The question is, how do entities that are using the framework detailed in the IOM publication share the information with others? How do you expect people to share the application of the tools? And secondly, when you consider the realist evaluation model, including the sense-making process, and considering context, were there certain strategies or methods that the committee wanted to see tested specific to obesity?
Well, the first question, I think the issue of reporting out the results of evaluations, if I understood the question correctly, really calls on all of us to look for opportunities to disseminate the results of our communities, across communities, to state and national agencies. One of the things we had the unique opportunity with this report to undertake after the report was completed was support from the Dell Foundation to take the report to the various agencies of government and to brief them on its contents and the suggested charges to those agencies for actions they could be taking. And so I think as you approach your evaluation challenges, in addition to the toolbox as a resource, we would encourage you to go back to the agencies that funded the obesity prevention program, all the way up to federal agencies, and to obtain a collaborative understanding of what went into the evaluation and what results are coming out.
Deborah, let me see if I can add to the Larry's response to the first question, which was how do entities that are using the framework share the information with others. The expectation there is that this link, feel free to share this link, pass it on. And this is meant to be free and open source, and feel free to pass that on to anyone that would be useful within your networks. The second question, though, is a little more challenging and maybe open for more discussion. And that's how do you expect people to share the application of this tool? One could imagine a collection of case studies that would emerge from community level application of this very generic approach. I'd sort of bump this back to Leslie for consideration, but there is no structure really for inhaling the exemplars that result from this kind of application, but a self-defining community of practice might work, and maybe this gets connected to NCORE and the work of NCORE, for example, and lifting up some case examples of efforts to address obesity. Leslie, what are your thoughts about lifting up exemplars of application of this approach?
I agree with you, Steve. I think the report itself tries to, one of the recommendations of the report is to improve access and dissemination of data or evaluation data that's being made. And so there's specific areas suggested where it could be improved. And it's mostly at the federal level, but there's definitely a lot of other organizations and others that could support something like this that Steve, you're describing.
Is there a mechanism, Steve, in the toolbox to collect the experience and data from the various communities that apply your tools?
What do you think, Christina? Yeah, is there a mechanism for collecting these exemplars?
Through the toolbox.
Yeah.
Actually, we do welcome real life examples that we feature on the community toolbox, and actually the same email address you've been using today, the toolbox@ku.edu address, we do welcome submissions to that account.
But to be clear, I don't think that's the best spot for a collection related to community efforts to prevent obesity, because the toolbox is cross-cutting in its aims. So I would look at a group like NCORE as a spot where there may be a collection spot, and Laura Kettle-Kahn or another colleague within that context might be willing to lift up some of these exemplars as it relates to obesity prevention.
Yeah. Great. We are receiving a number of other questions. Nadine Chan from the University of Washington has submitted a question. She says, appreciate the toolkit and resources for obesity prevention. Step 2 assumes the classic evaluation categories of process and summative evaluation. Developmental evaluation is an emerging category that allows the intervention to be nimble and shifting as needed for success. Any thoughts on resources or toolkits for how to implement developmental evaluation?
Nadine, let me take a crack at it. And I'm sure there's expertise on the line that would be more to your point. If by developmental, one meaning of developmental evaluation approaches is capturing the unfolding of the intervention over time, and this is part of that sort of complex adaptive system logic that Larry referenced earlier. And there are, of course, methods for doing that, and which typically involves the particular challenges of capturing what environmental changes are occurring. There is an appendix in the report that makes reference to some examples of this. I suspect your own work would offer even more detailed ones.
Great. Another question is from Susan Forrester. It says, for funders like Congress that expect causal relationships between props and results, what talking points would you suggest so they understand complexity and don't see as subterfuge or evasiveness? And also, do you see any differences in talking about adults versus children, low income versus others?
Yeah, our report grapples at length with the issues of the multiplicity of target populations, or populations that vary in their cultures, in their age ranges, in their needs for different types of interventions and so forth. We have one appendix that goes into great detail on the disparities issue and how to achieve greater equity in the provision of programs, the shape of programs, and the reach of the programs for different populations.
Larry, you're of course, have written a great deal about the distinction between evidence-based and practice-based knowledge. And a lot of what's emphasized here is sort of the appreciation that randomized controlled trials at a community level are not going to be a typical context for discovery and learning here. And that, in fact, perhaps our greater opportunity is multiple empirical case studies that show these associations, what some might call practice-based knowledge. So we appreciate that RCTs, randomized controlled trials, are the usual standard for evidence for what works, but also appreciate that there's so many different context features, and so it's so improbable that RCTs at a community level are going to be the norm for those practicing this, that case needs to be made as well. Larry, you want to add?
Well, there are paradoxes in this issue, and I don't think we have time to go into a lot of depth, but the more particular we can make interventions and their evaluation to a particular community, the more useful they may be to that community, but the less generalizable they may be to other communities because they've been made so particular. So we have to trade off, balance the question of generalizability versus specificity and relevance to a given community.
This is Christina. I wanted to share a few more questions that have come in. One is a question that's sort of already been addressed, but I'll share it as a comment. It says, thanks for sharing. This is from Cheryl Motor. It says, thanks for sharing these resources. The San Diego County Childhood Obesity Initiative is currently working on a State of Childhood Obesity report to be published in early 2016 using many of the recommended steps outlined in the toolbox. My question is whether there is any effort underway to collect and share community-level obesity evaluation efforts from across the country. We have a lot to learn from each other, and it would be helpful to know what other communities are doing to evaluate their efforts.
I wonder, Leslie, if you might consider reaching out to Robin McKinnon or Laura Kettle-Kahn or others active in NCORE to see, while there's a measures registry, I don't think there's a registry of community level efforts to address.
Right.
And I wonder if, I may be wrong on that, but if folks were to prepare case studies, if you would, that use this same framework and describe what they did, the process and the results, that might start another collection.
That's a great idea, Steve. Thank you.
Another question was submitted by Christopher Via Chow from the UC Berkeley School of Public Health. He says, like you mentioned earlier, many community obesity prevention programs typically have multiple components, levels, etc., but I haven't seen many programs evaluating the individual effects of each component. How do we tease out and evaluate these individual effects? Is this realistic and feasible for community level programs?
Yeah, this is one of my pet problems. The issue of wanting, as a result probably of the long history of reductionism in science, identify the specific contributions of individual elements of complex interventions. And I guess I've taken the opposite view, is that we really need to work harder at evaluating the complexities as a whole and to understand what is the synergistic effect of the combination of interventions rather than trying to isolate the contribution of individual interventions.
So with 1 minute remaining, I will share one last question that has been submitted from LTG Associates. It says, my question concerns the basic premise of obesity prevention efforts at the community level. In my experience working with some Asian American, Native Hawaiian, and Pacific Islander communities may not necessarily perceive obesity as a community problem. There may be issues of diet-related chronic illnesses that they may recognize, but obesity may be an emerging issue, or they may not see that as a problem. In such cases, in what ways would you suggest that communities utilize your toolbox? Also, how should your resources be introduced to such communities if they do not perceive the problem in the first place?
It's a lovely question. Reminded of the funder as stakeholder, waiting for communities to identify the right answer as being the categorical issue that their section happens to be addressing. Al Tarloff, who used to be president of the Kaiser Family Foundation, used to make the case that it may not matter so much where you start. If we're at a community level, in the community you're describing, it may be that the community engagement is the first step as you build the capacity of local people to take action, collaborative action on the issues that matter to them. And it may be that those other determinants related to the community's capacity to take action and change conditions may indeed generalize to affect a variety of outcomes. It really depends on who your stakeholders are and what matters to them. And your starting point may very well not be obesity.
Well said. I think that probably ends our available time.
Yes, I think so. We want to definitely thank everybody for their time today and interest in this resource. And to reiterate, this resource is hopefully making tools and information more accessible that was drawn from this Evaluating Progress in Obesity Prevention report that we described today. It was mentioned already that this webinar is being recorded and will be posted on this new resource page. So please feel free to disseminate this and share with others and use it as you wish. So thank you so much, and have a wonderful rest of the day.